Medical Testing and Practice Part 1, brought to you by Testing Wisely. Let's return to the 3Ps framework. Tests help clinicians identify disease and treatments to improve patient outcomes, but there are pros and cons to consider. The main benefit, or pro, of a medical test is to identify disease for which there is an effective therapy. But the harm, or con, of a medical test shouldn't be underestimated. Misinterpreting results and not understanding test probability could lead to a false diagnosis or misdiagnosis. Unnecessary treatments, undue stress, harmful side effects, and medical expenses. Let's walk through a clinical case to better understand. A doctor is concerned about a patient, Mr. Phillips, who may have heart failure. Mr. Phillips is a 62-year-old man. He smokes and has high cholesterol, type 2 diabetes, and coronary artery disease. At his appointment, he complains of trouble breathing. Mr. Phillips used to take his two dogs on a walk around his neighborhood. Now he can barely make it down the street. He has trouble laying flat at night and now must sleep elevated on several pillows. On physical exam, Mr. Phillips has labored breathing and fine crackles are heard on inhalation. There is S3 heart sound, elevated jugular venous pressure, and bilateral lower extremity edema. A test for heart failure is the BNP test. A mildly positive BNP is sensitive for heart failure, but not specific. A high positive BNP is not sensitive for heart failure, but is specific. BNP, like many tests, has a trade-off between sensitivity and specificity with lower or higher values. Another way of visualizing the change in sensitivity and specificity is considering populations. A mild positive identifies 90% of disease but is 76% specific. A high positive is 62% sensitive and 93% specific. And remember, the pretest probability of 70% means Mr. Phillips is likely to have disease before the test, which makes false negatives the bigger issue. Let's consider Mr. Phillips with different results. A BNP level of 80, 250, or 1000. Mr. Phillips has a pretest probability of 70% for heart failure. A BNP of 80 is negative with a sensitivity of 90% and specificity of 76%. A negative result decreases the chance that Mr. Phillips has heart failure to 23%. A 23% chance of heart failure means he could still have heart failure with a negative test result. In fact, the treatment threshold for heart failure is around 15%, so many would still treat him. Mr. Phillips may be better off without testing, as doctors will take the same action either way. If Mr. Phillips has a BNP level of 250, that is a positive using a cutoff of 100, meaning a sensitivity of 90% and specificity of 76%. A positive result means a 90% chance that the patient has heart failure. 90% is more than 70%, but certainly hasn't changed that much. If Mr. Phillips has a BNP level of 1000, this is a positive by a cutoff of greater than 400, meaning a sensitivity of 62% and a specificity of 93%. A positive result indicates a 95% chance that he has heart failure. Higher test results may miss many cases but have greater specificity. In the setting of high pretest probability, false negatives are more common and testing often has little value. The pearls to remember from these practical examples of medical testing include: there are pros and cons for every test. Treatment thresholds are how likely a diagnosis must be to initiate treatment. For tests with a continuous range of results, there are different sensitivities and specificities for very high versus normal results. Visit www.testingwisely.com.